Hello, I am Leo Mileki, a PhD student at Centrale Supélec Paris-Saclay University in France, and I'm going to present you our work called MEDIMP, 3D medical images with clinical prompts from limited tabular data for renal transplantation, which is joint work with l'X Lab Polytechnique in France and Necker and Georges Pompidou Hospital in Paris. I will be presenting this work in the first poster session on July 10th, and our code is available with the following QR code. So, identifying biomarkers from high-dimensional and multimodal data for renal transplantation is very challenging, as renal transplantation emerges as the most effective solution for end-stage renal disease, but a substantial risk of transplant chronic dysfunction persists, and it may lead to the graft loss. In clinical practice, medical imaging play a substantial role in renal transplant monitoring, but this monitoring is also multidisciplinary, notably joining nephrology, urology, and radiology. Therefore, learning powerful representation of medical imaging data of renal transplants, coupled with clinical and biological information, is of utmost relevance for this application. Our goal was to leverage the recent success of large language models coupled with multimodal representation learning. In the recent years, um, natural language processing domain have seen the emergence of large language models, which make textual data a potent candidate for designing weakly supervised tasks to train computer vision models. At the same time, multimodal pre-training using multi-view contrastive learning has been investigated to take advantage of jointly training an image and a text encoder, such as approaches like CLIP for natural images or CONVERT for medical images and radiology reports. In this work, we are proposing a semi-automatic medical prompt generation from tabular data to leverage the expressive representation of textual data from NLP models. And we are extending existing works on combining text with imaging data by integrating limited 3D medical and textual data of renal transplants and fine-tuning strategies. Here you can see an overview of our proposed method, where we design medical prompts to guide the learning of meaningful representation of renal transplant DC MRI. First, from clinical and biological data and a few variables, we are making manual sentences templates such as the age of the donor is high. Then, using large language model prompting, more particularly with the LLM ChatGPT, we perform text augmentation of these sentences to obtain expressive textual data. And we use this data to train an image encoder jointly with a text encoder from our DCMRI of renal transplants using multi-view contrastive losses. We show in our paper that the obtained visual features encode the information, the clinical and biological information present in the textual data, and that the obtained features enable us to outperform state-of-the-art on a relevant downstream task for renal transplantation monitoring. More specifically, trying to predict the creatinine level after 2, 3, and 4 years. So thank you for your attention. Do not hesitate to contact me for further information on our work, or come see my poster and discuss on Monday, July 10th on the first poster session, and the code is available with the following